I'm Pamela Wheeler. I have been in law enforcement for 20 plus years. I work with substance abuse and with mental health. Substance abuse is the excessive or overindulgence in a mood-altering substance. It could be illicit drugs, it could be prescription drugs, it could be legally prescribed drugs, it could be alcohol, or it could be over-the-counter medication. It is the act of the overindulgence where it becomes a substance abuse. Regarding risk factors and successful reintegration into society, we look at criminogenic risk factors. And substance abuse falls into one of the high-risk criminogenic factors that we review. The criminogenic needs are risk factors that have been identified as contributing to recidivism and new arrests. So substance abuse is one of those high-risk factors that are identified. We want to address the substance abuse with proper referrals and getting them in for a clinical evaluation and for therapy. Substance abuse is often overlooked or underestimated. So we may have individuals who think, oh, I've got this. Oh, I don't need treatment. I'm sober. I don't have time for treatment. I have to work. These are situations that we can relate to. However, the substance abuse is only the surface level. There's typically underlying issues, underlying behavioral issues, feeling pain, loss, abandonment. Those are particular behaviors that therapy and substance abuse treatment is actually going to identify. And it's working through those underlying issues that allows the substance abuse to be more controlled and to remain in recovery. Abstaining from the use of illicit drugs is just the first step. What we want to do is get the abstinence from the substance abuse, then move into substance abuse treatment, dealing with those issues and moving forward into a sober life. There's several types of treatment that an individual could be referred to. Initially, the first step is going to be detoxification or going into a detox. This is the process of removing the substances from the body. Offenders may be incarcerated. It could be upon that incarceration that they complete the detox process, or it could be done medically in a medical facility. There's a lot of pain that could be associated with the detox process, so it's observed medically for that treatment to help prevent those side effects. But it is necessary. It's very necessary for that first step of the treatment process. But immediately following detox, we want to get folks in for the assessments so that those proper referrals can be made to a clinician in order to implement the proper treatment. There's the different kinds and the different types of treatment that could be offered are long-term residential programs. They could be anywhere from 6 to 12 months. They're going to offer structured counseling, structured individual counseling, group counseling in those substance abuse programs. They could enter into a short-term residential program, which would be up to 6 months, where they may be able to leave more frequently, to work, and visiting family more often. Outpatient treatment programs vary in their intensity. We could have basic drug addiction programs, or the intensity of that outpatient treatment can exceed 9 hours of individual and group counseling within that one given week. So the intensity of the treatment plus the duration would help to meet that outpatient treatment requirement. An individual may also have individualized drug counseling, where they're going to work one-on-one with a counselor to help identify a treatment program that's going to be modeled to their particular needs. They often implement group counseling with those individualized programs and also self-help and 12-step programs in the community. Group counseling could be a recommendation of the clinician after the assessment. The group counseling would be just that. It would be a group setting of peers being able to discuss difficulties that are faced with addiction and maybe some issues that they may be experiencing at that point and how to get a better idea on dealing with those, as well as self-help groups to help reinforce that as an aftercare process. There are, of course, the 12-step and the self-help groups, which are community-based programs of anonymity, coming in, every acceptance. They're going to get group peer advice, being able to vent and get those issues off their chest, but also to get that accountability from a potential sponsor or from someone who's been in the program for a while. They're going to be able to get that reinforcement of these are the ground rules and being able to address the behaviors that are associated with substance abuse. How are they going to get into the program? How do they get these assessments? So the American Society of Addiction Medicine, we refer to it as ASAM. They have established criteria for different levels of treatment that where an individual would qualify. Doesn't mean that they could not transfer to and from. They can a higher level of care to a lower level of care on an as-needed basis. So we may have co-occurring disorders. Co-occurring would be a dual diagnosis of mental health and substance abuse. So we want to make sure that the program that they're in will meet those needs, but it may not be something that's identified immediately. It may be something that comes on down the line where we decide that someone needs to be moved up to a higher level of care. The continuum of care is the standard level of care that is utilized by treatment providers. These are five levels that have been identified by ASAM. The level 0.5 is where there is a possibility of a substance abuse issue. However, it's not been identified at this time. If we have someone who may experience exposure to the substance abuse in the home or may have family members, they can get counseling, maybe some reinforcement on how they can deal with issues without any kind of substance abuse. Level 1 would be the outpatient services. These are less than 9 hours of treatment in a clinical setting. Level 2 would be the intensive outpatient services, which are at a minimum of 9 hours and could exceed more, or partial hospitalizations. So they're having to go in for into actual hospital it could include detox procedures or additional treatment or co-occurring disorders. So if they are experiencing the mental health and the substance abuse simultaneously. Level 3 would be the residential or inpatient services. They can progress to a more serious hospital setting for an extended period of time. We have the level 4 is somewhat of a supplement to the previous 3 levels, and that just makes sure that we address the mental health and that they're able to identify the mental health component in conjunction with the level of treatment that they need. Those are levels that are used by the clinician to help determine what is going to be best for the individual. They can fluctuate. We want to make sure that the individual has a more personalized experience so that we can identify what is going to work best for them in the long term. But it's paramount that individuals identify that they need the treatment in order for it to be successful. Those referrals can be made by their own personal admission. We may receive them from bond conditions of their probation, or conditions of their parole. Any way that we get them and we're able to get them assessed, we want them. We want to be able to have individuals come in and actually get that education. We want to help eliminate the substance abuse and help to restore them as productive citizens, not without this continuous battle. There are several places that offenders can go in order to get information on a referral. Identifying the issue, we have a SAMHSA's national hotline, which is 1-800-622-HELP or 1-800-622-4357. That is a national hotline that you can be connected with representatives that can give you more information on local facilities and where you can go. If you are privately insured, then you can contact your insurance provider and they can give you information over the phone, or you can contact the insurance provider through the internet and be able to see what is going to be best for you and what you can reach in network. Uninsured or Medicaid or Medicare recipients in Georgia can utilize the Department of Behavioral Health and Developmental Disabilities. The Georgia Department of Behavioral Health and Developmental Disabilities offers community-based services at dbhdd.georgia.gov /regional field offices. The North Georgia area is to contact Region 1. The main contact is 678-947-2818. And 12-step and self-help meetings can be found online by region. You can also, there are several programs of the AANA Celebrate Recovery that offer smartphone apps that can be downloaded, and you can do it by your location so that you can find somewhere at any time during the day. Some of the criminogenic needs that we have that we've identified that contribute to recidivism are going to be housing issues, employment issues, substance abuse issues, mental health issues, and we want to address those with referrals as best as we possibly can and try to help someone become more stable in their residence, help them to obtain a job so that they can provide for themselves at that residence, address any mental health issues and their substance abuse issues. The substance abuse portion is a serious risk factor because of its legal factors and any being in possession or continuing to use can jeopardize housing issues, it can jeopardize employment issues, and it has a negative effect on mental health patients as well, or those with co-occurring disorders. It's hard to say, is it the chicken or the egg? Because it could be a mental health issue that is contributing to their substance abuse. It could be abuse, it could be abandonment, it could be early exposure to the substance that is leading to their continued use. But in order to provide for their continued use, where they're committing the crimes of theft or being found in possession of the substance abuse. So those are continuing to compound their issues. Individuals with substance abuse addressing that early have a greater chance of reducing that recidivism, a greater chance to avoid being arrested in possession, or there would be no need for the theft or burglaries, etc. It's helping to address those underlying issues in the substance abuse, obtain sobriety through detox, address with proper referrals, in a clinical setting, getting the therapy that they need. It requires honesty. It requires admitting that they have a substance abuse. And that can be painful. That can be one of the hardest things that you have to do, is admitting that you need help, admitting that you do have a problem. Your problem has contributed to continued arrests, continued drug abuse, continued strained relationships with family members and loved ones, job loss. It's admitting that has been the bulk of your problem, but admitting that and moving forward allows you to heal or organize those behavioral issues and make it where you can function and you can tolerate life and struggles without a substance, and moving forward to become that productive citizen. It is a problem. It is a problem that's going to take help. You can't white knuckle it. It's what we call when you're hanging on and you think, I've got this beat, I've got sobriety. I'm never going back to it, because I see all the the hurt that I've left, it's like a path, it's a tornado that has torn through your life, and you have this entire path of destruction. And you can say, okay, I've got it beat now because I don't ever want to go back to that. I don't want to go back to that. You can see it. You're sober. You can see it. But all it takes is unable to cope with stress that is going on, unable, it could be a flashback from a horrible event in your life that at that point, none of that destruction is at the forefront of your thought. None of that destruction plays a part. It does not hurt as bad as what you're going through in that moment. And if your coping mechanism has always been a substance abuse and you don't have any other education on how to change it, you're going to go back to what you remember and what worked. And the substance abuse worked. We want to change that. We want them to see that the destruction can be repaired. It may not ever be the same, but it can be repaired. And working with that clinician in order to address those underlying issues, repair the relationships that you have with loved ones, and moving beyond it, because this does not define you for the rest of your life. This is just a moment, and it's a season that's gonna pass, but you have to have that education or you're gonna be destined to continue in what you know works. If you have insurance, that's going to be the avenue that you're going to need to take first, is being able to contact your medical provider or your insurance provider, getting the list of in-network counselors and clinicians that can do those assessments and provide the treatment. If you are uninsured or you have Medicaid or Medicare, the state of Georgia provides community-based services that are able to assist with uninsured or those government assistance insurance programs. They are locally, by region, by our circuit. We are very fortunate in our circuit to have one in every county. But in this state, there are some that are at least within driving distance, and you can make arrangements with the program. At a bare minimum, there's going to be a 12-step or a self-help program within driving distance of all of our Georgia cities. That's one thing that we're very fortunate for, but in making those relationships with those 12-step and self-help programs are going to be paramount to helping to anchor you into the community. That you're going to be able to get a sponsor, build relationships within those individual programs, have a home group that you can go to where you're going to have the individual support. So even an individual coming out of an incarceration that has absolutely no one can still be successful. It doesn't require a supportive family. So when I hear, I don't have anybody, I don't have anyone that is there to help me or to care, well, you do. It just requires a little bit of effort on your part to reach out and to make those connections, and having vulnerability is an exposure, which is hard, but being vulnerable and asking for that help. There are plenty of folks who've been in your shoes before that are willing to reach out and offer assistance. They just want to see the effort on your part. That's it. They want to see that you're willing, that you have decided that despite everything that's happened in my life, I'm ready to make a change. So you don't have to have anybody on the outside for an entire community to rally around. All 12-step and self-help meetings are free. It's a community-based. They work on donations from time to time. They do. If you come into a setting of say an AA or an NA, and they have snacks or coffee, if you don't have anything to donate toward the coffee or the snack fund, they just ask that you help and maybe volunteer, set up tables, clean tables. They're not asking for your money, but to keep the coffee flowing and to keep cookies there, I mean, it helps. There's faith-based programs. There's the faith-based self-help, where it is in a church setting, but they'll welcome you with open arms. Come on in. A lot of times they'll even have food beforehand to feed you, just to keep you. If you have children, a lot of those that are with Celebrate Recovery will offer childcare, and the children or the teenagers can even get their own education that is geared toward their age and something that they can understand. But that way, we're trying to eliminate as many roadblocks as we possibly can so that there are no excuses, because we don't want excuses. We want you to come in and to feel welcomed, to feel comfortable to address your issue, the underlying issues, in order to tackle the substance abuse and remain in sobriety as long as we can possibly keep you there. Those individuals that are being released from incarceration, it may be a condition of their bond, it may be a condition of a new probation sentence, or it could be a condition of a parole certificate to obtain substance abuse assessment and follow through with any recommended treatment. The majority of sentences, anyone that has a drug-related charge can expect something along those lines. Anyone who has an admitted substance abuse past can essentially expect that those are going to be some of the conditions, because we do want to address that high-risk need, that criminogenic need, and to help eliminate any further recidivism. So that's typically going to be a condition of those sentences or those bonds. Throughout 20 plus years in law enforcement, I have witnessed individuals who are experiencing those withdrawal symptoms, attempting to combat those withdrawal symptoms on their own, and struggle, and it's ugly. It's very painful. It's an ugly process, but we have detox facilities throughout, not throughout every judicial circuit in the state of Georgia, but they're close by or can be done in a hospital setting. We do encourage those for painful withdrawal symptoms from opioid use, heroin use being topping the charts these days. We do encourage that. The methamphetamine use is rampant. It's been rampant my entire career. I never worked in law enforcement a single day that we didn't have to battle methamphetamine addiction, and watching the deterioration of individuals over a period of time from their just beginning their substance abuse to now being 20 years into our professional working relationship, and just the toll it has taken and how many years it ages an individual mentally, emotionally, but ultimately physically, and the health problems that are associated with all those. With methamphetamine, from dental to internal, but unfortunately, one thing that we see more and more of now with the opiate addiction is how many we lose so early in life to overdose. It's taking substance abusers by surprise. They're not expecting it to be in a pill that they just purchase from the street level, or they're not expecting it to be in the heroin that they are so accustomed to using. And so overdoses are accidental. They're not because they were caught off by surprise and they didn't know how to handle that. They had used entirely too much, and it's so deadly that it's affecting a lot of our youth. Not to say the older population isn't subjected to it. They are, but it's killing our youth at a higher rate. You're purchasing street level drugs it could be included in what you're considering a Xanax, or what you think is going to be an oxycodone or Roxy, but those are pressed, and it has fentanyl in it, and that's what's killing. I find it in powder form. It's in everything now. Nothing is off limits. We're finding it more and more, and surprised. They're surprised when they're testing positive for it, or surprised when they're finding that they're being charged with possession of fentanyl. So it's really catching a lot of people off guard, but the overdoses have just compounded, and it's scary. It's something that we really hope that we can prevent, reduce the substance abuse, so that we can say, you don't know what you're getting. You don't know. It's more dangerous out there now. Buying street level drugs, you'd think, like, that hasn't been dangerous all along. Yes, it's been very, very dangerous all along, but at this point, you just don't know what the drugs are mixed with. Officers are issued Narcan. With the office I work with, we use the nasal Narcan. So it is a 4-ounce bottle that is used for each nostril, and if we identify that someone that we have encountered is unresponsive, and it could be to an opioid overdose, then we administer that, provide care to them, and contact our local EMTs. It's not a pretty process. It is ugly, because it's going to put a stop to that opioid process in the body, which can lead to severe agitation. This can lead to vomiting. And that's going to be part of it, the care that you render at that point once you've administered the Narcan, until you can get further EMT or paramedics there to help you and get them to the hospital. It completely puts a stop to that opioid process right then. So it's where the opioid is processing through the brain. It's going to put an end to it. So you're going to get that agitation. You're going to get them back, and it could be short-lived depending on how much the opioid they have ingested, whether it's going to take one bottle or whether there'll be more administered over a period of time. It just depends on the person and how much, and our goal is to get them back. I know I have administered it. Several officers that I work with have administered it. It is something that we want to get that person help. We want to get them in. Sadly, I had personal knowledge and worked with individuals that have overdosed numerous times and had to have EMS personnel come out and treat them, or they've been hospitalized because of the overdose. And sadly, it's not stopping. It may slow them down, but it's not stopping drug abuse or the opioid use like we would think it would stop. Like we would hope it would stop. Is, hey, you realize you almost died, but it's not. Because the addiction is so strong. The craving for the drug is so strong that you forget that tornado of destruction that you have experienced, that laid in the wake before, and you said, I'm never going to do this again. You forget those and go back. And unfortunately, the overdose is part of that destruction that you forget. And we lose more and more. It's a sad process. For an individual to just make the decision that they're done, that they have moved, that they are changing their life into a productive citizen and being that a integral part of our society. It takes the education, it takes the sobriety, it takes reaching that obtaining that sobriety, going through that detox. It takes having the education component. An individual may go through counseling. We may send them, they could graduate 6 programs and still relapse. We understand that. We don't accept it as an excuse. That's not a justification. But we will accept it. We want to encourage them to glean any bit of information from those programs, and let's build on it. It's okay if you've been through 3 times. It's all right. Let's take everything that you've learned from every one of those treatment experiences and let's make this last one work. Let's take something. You're gonna, if you're sitting in a class, you're gonna gain some information each time you go through it. It's okay to go one more time. Let's go one more time and get to a point where you're sober, you have the education, you have ties to the community. Your tie to the community could be employment. It could be that you now have an apartment. You're responsible. It could be having that tie with your children and your children in school, and you've worked so hard to get your children back and to be trusted with them it could have been family members that have them, often it is, and you've gone through the process where now you have something to lose. You have responsibilities, and that contributes to being more successful for an extended period of time. So build those relationships with employers, build the relationships with outlets such as your Celebrate Recovery or your AA and NA. Build the relationships with your children and your family and have those ties to the community, because that's what's going to keep you grounded.